Hi, my name's Scott. I'm the Medical Director with CPA Group, and I'm talking to you now from the reception of our head office here in Brisbane, beside one of our fire and rescue vehicles. I wanted to let you know about the CPA Group Health and Wellness Calendar for 2019, which has been launched. Today, I did a presentation to the head office on healthy hearts, and there's a link in the newsletter that shows you the presentation. I'll give you a few tips on that in a second. But if you're interested in either for yourself or for your work site getting some posters and presentations, then please follow the other link on the newsletter to Jennifer in head office, who can help you out with all of that stuff. So today we talked about healthy hearts, a really important topic. It's one that kills more people through heart attacks than any other disease in Australia. So it's a really key one to get some messages across. So if you're one of the medics in our company and you're about to present this presentation to the workforce, then there's lots of interesting information in that presentation. But if you're just looking at this, want a bit of information about how to make your heart healthy, then I'm going to give you some tips on that. And I suppose what we're trying to do is to avoid what happened to Fred here. Fred was one of our workers who didn't listen to my presentation and ended up with, well, an unhealthy heart. So what can we do to improve the health of your heart? There are a few things you can't modify. You can't modify your age. Obviously, as you get older, your risk of having a heart attack or angina goes up. If you're male, your risk goes up. And your family history is important. If you've got siblings or parents that have had heart disease, then unfortunately your risk is somewhat higher. But there are some really good things you can change. Obviously, we know that blood pressure plays a part. So please know your numbers. Go and see your GP and get your blood pressure checked. And we're looking for blood pressures below 140 or 90, certainly. We'd like you to know what your sugars are. Make sure you don't have diabetes. So again, know your numbers. Go and see your GP. Your cholesterol is really important. With high cholesterol, you get fatty deposits inside your arteries, particularly the arteries around the heart, and this can lead to heart disease and heart attacks. Also, obesity. It's a struggle for many of us to keep weight down, so really this is important. We know that the risk factor of, if you're obese or have a BMI, body mass index over 30, and you can look that up on the web as to how to calculate that, your risk doubles for a heart attack. And combined with that is exercise. So exercising about 150 minutes a week in small sections is fine, rather than one big chunk. Really important. And I think just taking care of yourself, sleeping well, and that means trying to get 7 or 8 hours of sleep, trying to relax and reduce stress, because again, we know stress causes heart disease and strokes. So really try and keep that as under control as possible through, again, exercise and modifying what you're doing at work and at home. So they're just some of the tips that we have. The presentation goes through in a lot more detail about what a heart attack is. It doesn't really cover, to be honest, what a heart attack looks like, if you how to recognise one. So very quickly, to end, a heart attack looks like, well, there's a variety of symptoms actually. The main one is chest pain. You might see someone clutching their chest, and that's the classic tight pressure in your chest. But you also might get arm or neck pain. You might get pain in your jaw or your tooth. You might get pain in your back. So all of these things combined can increase the chance that what you're experiencing is heart pain or a heart attack. So if in doubt, of course, seek medical advice quickly. Every minute counts. As they say, time is muscle. We want to keep the heart muscle as alive as possible by getting treatment, and there's good treatment for heart attacks, as quickly as possible. So read the presentation. You're free to contact me, of course, if you've got any information, but know your numbers. Go and see your GP or local nurse or medic and find out your cholesterol, your sugar, your blood pressure, and your BMI. And if you can modify all of those, then hopefully you won't be meeting Fred anytime soon.